Hello, Don here. Welcome to Podiatry Practice Mastery, where we're going to help you get your practice to the $1 million mark and beyond. Today I'm going to record a day of my most valuable patient today was a 21-year-old female. She had bilateral bunions, and usually with bunions I talk about number 1, shoes with anatomic shoes, number 2 would be orthotics, and then number 3 would be correct toes. And so I gave her shoe recommendations and we scanned her for orthotics. So my goal each day is to do 2 pairs of orthotics. That'll help me get to my 40 per month. That's kind of what I'm trying to get to. So that was a simple one. It wasn't anything too elaborate, but I'm going to go over the rest of the day here now. Next was a 61-year-old man. He had status post warts for Swift. Now, he had kind of an interesting condition. He had some lichen planus in his mouth, and we were hoping that by treating the warts on the feet, that would kind of go away or calm down. It didn't really help all that well in his mouth. His warts got much better, but he also had bulbous Achilles pain. So he had a bulbous micro tear to the Achilles, and we did 6 sessions at a shockwave. He is doing much better with that. And we did a physical therapy prescription now for his Achilles because it continues to bother him a little bit. He's kind of okay with the wart. They've been there for a long time, so we didn't do anything else. Next was a 62-year-old man. He's here probably on like Qutenza number 7. And one thing with Qutenza, you can't do it the same day as nail care. So we did Qutenza, and I'm going to see him back in a few days for nail care in the office. He is actually feeling so much better. He doesn't need to use any of the topical creams that he was using before. So it's been beneficial for Qutenza. What we found for Qutenza, really think that using a specialty pharmacy is the better way to go because it doesn't inflate your numbers in your office. It's kind of like if you're doing a lot of graphs, the graphs inflate your numbers saying like you produce so much more. But really for the Qutenza, like the $4,000 for the Qutenza really is just a wash, and then what you actually get is a lot less for the application, but it still is something. Next was a 29-year-old female. She had her right second toe. She was concerned about a fracture. She was seen previously by an urgent care, and they were concerned about like a stress fracture to the toe. What it appeared to be was a combination of some Raynaud's because of the winter and also a hematoma that she had underneath the toenail. So I told her that. I got an x-ray. Everything was fine. And we talked about the Raynaud's a little bit as well. And then she had some pronation bilaterally, and I think the pronation is causing her toes to flex down, so like a flexor stabilization due to the pronation. And then also for that, I recommended an over-the-counter orthotic. So she's going to start with those. I've been starting to do more over-the-counter. We have the Northwest device over-the-counters. They're pretty nice. I think the shell is nice and rigid, and they're a pretty reasonable price point, about $60. So I tend to start with the customs as the best option, but some patients want to start with that. So I've kind of changed my tune, I think, over the years. In the past, I never even offered an over-the-counter, but we now have this over-the-counter that I'm offering as well. It works well in dress shoes as well. Next patient was a 60-year-old female. She's here for an orthotic follow-up. She has a cavus foot. She was doing really well, and when people come back in and they're doing well with the orthotics, I always say, and I learned this from another doctor, I don't care if you have 2 pairs or 100 pairs of orthotics, but having a second pair helps increase compliance because you're wearing it more often. You don't have to switch it around. So she opted for a second pair of orthotics. So that was my second orthotic of the day. It's not full price, but it still was the second one. Next was a 65-year-old female. She had a wart, and I did cantharidin on that. Next was an 82-year-old man, a right IND for an ingrown toenail. Next was a 60-year-old female for 2 warts. We did cantharidin on there, and we did x-rays because they were painful. My staff did. Next was a 71-year-old female for number 3 out of 6 for shockwave for plantar fasciitis. Next was a 65-year-old man. He had left dorsal neuritis. He's kind of an interesting case that I actually got Cigna. He wanted to go through his insurance using the T code for shockwave, and it was covered. So he's number 4 out of 6. They've been reimbursing at about $175, which I'm not sure if they actually reimburse at $175 or they're just paying half of what I billed. So I billed $350, and they're paying $175. I'm not sure which one it is. But as long as they're paying, we're going to continue doing it. For him, I'm still telling most patients, though, it's not covered by insurance. Next was a 68-year-old female for left foot status post 6 sessions of shockwave for posterior tibial tendon dysfunction. She also has some midfoot arthritis. Because of the midfoot arthritis, so her posterior tibial tendon got better, but this arthritis is still bothering her. We've tried cortisone injections. I'm going to get an MRI for her. And then she also had some bilateral hallux onycholysis about the distal half, so I took a nail sample of one of those to see if it's a fungus. And so she'll be back in about 3 weeks. Next was a 21-year-old. This is the bilateral bunion that got orthotics. Next is a 63-year-old female. She had bilateral partial nail avulsions, and she's following up, meaning I just took out the edges. There was no signs of infection. That's why it's a partial nail avulsion versus an IND. She had some Raynaud's, and so we started to do EBM medication in the office, or creams or pills, and there's a cream for Raynaud's. I'm going to have her try this, and I'm going to see her back in 3 months. I'm thinking using more EBM these days is probably going to offer me some more follow-ups. I think they're going to be quick follow-ups, so they're probably going to be my 10-minute follow-ups here in the office. I'll tell you when she comes back how it's working. Next was a number 3 out of 6 for second met head pain. I offered again orthotics, and she declined orthotics. So I also like to track the number of no's that I get, so this is a no for me. Next was a 75-year-old female for right hallux callus. I trimmed the callus. She thought it was a ganglion. It wasn't a ganglion, and for her we did over-the-counter orthotics to help offload the callusing, and she also has midfoot arthritis that I saw in x-rays. I'm going to see her back in about 3 months to see how she's doing with these over-the-counter orthotics. Next was a 71-year-old with a right FHL pain and plantar fasciitis pain, number 5 out of 6 of shockwave. That was the morning. Afternoon was a 57-year-old female, status post-matrixectomy, then a 15-year-old bilateral, he called it duck feet, really had a lot of pronation. He had orthotics from 2024, so he already had orthotics, he just wasn't wearing them, and he had equinus and posterior tibial tendon dysfunction. And so we talked about wearing the orthotics, and we talked about AFOs, but he's just going to wear those and do like foam rolling on the back of the calf, and I'm going to see him back in 6 months. Next was a 47-year-old female. She had right posterior tibial and anterior tibial pain, number 6 out of 6 shockwave. So this is the last shockwave. So just so you know, when I do the last shockwave, I give them the last shockwave treatment, and that's how I can do an office visit the last visit. I'm going to see her back in 2 months. Next was a little wart, a little 7-year-old female. I did a cantharidin on there. And next was a 17-year-old with Raynaud's on the toes. Also had pronation and callusing. So we did an over-the-counter inserts for this one, and talked about Raynaud's. I'm going to see them back in 2 months. Next was a 59-year-old man. He had a left second toe. He was planning on an amputation in February because of a long second digit, but I debrided that second digit. This was one of my colleagues, so it was just basically an ulcer debridement. 43-year-old female for number 4 out of 6 for posterior tibial tendon pain. 78-year-old female for a left third toe ulcer. I just debrided the ulcer. And then the last patient was a bilateral splint. They were wearing this 20-year-old bilateral equinus works at, I think it's like Staples for like the Geek Squad or something like that, or Best Buy, and needs orthotics. I dispensed the orthotics to her. She has pronation. She also has a lot of equinus. Because of the numbness, I find that a lot of times night splints do give them numbness. I try to have them take out the wedge that's in the front, reduce the size of the tightness on the sides, but we upped the size. We increased the size. Another thing I was going to talk about, I was talking to one of my buddies here, and he was telling me I was re-listening to our conversation, and he a lot of times adapts some of these over-the-counter inserts. And so what he says is I want to do the least expensive thing that'll get you 100% relief. I think that's a good phrase we can use. I want to do the least expensive thing that will get you 100% relief in terms of orthotics. So he starts with a lot of times over-the-counter orthotics, but if they have a lot of pronation, he will post it medial. He'll do like a medial post on there, and then he'll also sometimes add like a reverse Morton's extension. I'm sure he has these things kind of pre-prepared that he can just stick on the bottom of the orthotic and see how it feels, and if it feels good, then you can add that into a custom device for them. So I kind of like that method, and he does more orthotics than anyone else that I know. So something to consider, and I like that wording. So this is the recording of this day here. Once again, if you want to learn more, go to Podiatry Practice Mastery. I have $1 million kind of a template of how to get there, kind of the best things that work to get your practice to the $1 million mark. If you really haven't gone through it, I would recommend you going through it. I think there's a lot of good resources in there for you. Okay, until tomorrow.